thing I liked most about Sarah was that she would get down on the floor with the dogs. And
I love how when she walks into the room, she's always laughing and happy to see the client and happy to see the patients.
She builds a bond very quickly with people.
The love that she has for her job, it never dies.
Most people who know her and know her well would do anything at all for her, and myself included.
It's going to be hard when she's gone.
Man, I am really going to miss Sarah.
Wanting to work with animals is something that I wanted to do starting out as a little girl. A lot of veterinarians do. I grew up on a farm in southern Rhode Island, and we had chickens and cows and sheep, and I just always knew I would work with animals. And so even at a young age, I found myself really interested in, I wasn't sure what I was going to do, but I was quite sure that it would be something related to animals. A few months before I graduated, I got a phone call from a doctor who lived here. His name was Dr. Bob Shugart, who actually owned Mendocino Animal Hospital in the 60s. And he called me up and he said, "Hey, Sarah, do you have a job?" And I said, "No, I don't really have a job yet." He said, "Well, there's a guy here in my town who's looking for an associate." So I said, "Oh, okay." So I came out here, I got out a map, and I found Ukiah, and I drove up here and met Dr. Tom Broaddus, who was wonderful. He offered me a job, and I said, "Yeah, no, that sounds good." I drove back, and I said to my husband, "Oh my God, that is the most godforsaken little hick town I have ever laid eyes on. I'm sure I'll only live there for a year or two." And that was in 1978. So there's part of the story right there, which is people make a location. So it's the people that I met. And then pretty soon there wasn't any place else I was ever going to be except here. One of the things I love about working with animals is animals are pure. They are exactly what they are. Whatever you see coming out of them is real. Whether they're frightened, which many, many, many of them are coming in here, whether they're frightened and therefore aggressively angry, whether they're frightened and hiding under the chair, but they're real. There's nothing, there's no, maybe he's got this kind of, I don't know, maybe he's trying to pull that one on me. That's not it. Animals are absolutely real. And I also want to say that I have been fortunate that literally every day I wake up and say, I get to go to work today. That's really, really how I feel. Not everybody gets that. I have a letter from a 8-year-old boy who I fixed his chicken's broken leg, at the end of the 80s, and he wrote me on a yellow sheet this letter about, I want to tell you about my chicken, and that she was my chicken because I fed her all the time, and one day she got her eye pecked out, so then I started feeding her separately, and after that she followed me everywhere, and I don't know what happened, but one day her leg wasn't broken, and the next day it was. So I asked my mom what we could do, and Mom called veterinarians, and nobody could see her except you said you could see her, and you said you could fix her leg for $20. So she's doing great, the cast is fine. Thank you very much, Patrick. I mean, you can't buy this stuff. I've watched this practice from a little mom and pop store, essentially down on South State Street, to here where we are in our beautiful, really state-of-the-art facility, and I'm really proud of that. I'm really proud to be part of that. And it is going to be a little hard to walk away. 40 years of serving this community has been really wonderful. It's really been great. So I will miss that, that's for sure. I want to say to anybody who wants to know that there is not a doctor here that I would not 100% trust with my animals, not 100%. They're exquisitely good. And we have a front office staff that is so welcoming, and they're smart. They know what they're talking about, and they're empathetic. We have the registered nurses of the veterinary world, the RVTs, registered veterinary technicians. The staff is hardworking, they're fun. I mean, they're as goofy about their animals as we are. And I think that when you walk in this door, whether I'm here or not, you will get a really good feeling about who we are, about what we offer. And as I say, if I had to bring my animal anywhere in this town, it would be the Mendocino Animal Hospital, because I know their heart.